after my residency. And I did a Commonwealth Fund Health Policy Fellowship at Harvard, where I got an MPH in Health Policy Management. And that's where I was introduced to the concept of ACEs and adverse childhood experiences, and I read the 1998 paper. And for me, it sort of brought a lot of things together. And I started to really think about those 10 ACEs and think, well, wow, I know that they're more common because I just knew that from my own training, right, amongst economically distressed populations and populations of color. But like, those 10 ACEs don't capture the broad array of traumatic and stressful experiences that kids can have growing up in an urban, economically distressed setting. So I really wanted to work to broaden those experiences to include violence exposure and racial discrimination.
For me, it's very similar. I think I was drawn to ACEs work before I knew what ACEs were, before I knew what toxic stress was. I think growing up Black, you understand that the margins are really thin. You kind of know, as a young Black male, you do one thing wrong and your whole life could be ruined. And you think about, the generational trauma that they live with, and you think about the trauma that's ongoing and kind of how it impacts them. And, as a pediatrician, when I was in my training, I really wanted to think, well, what can we do better to meet the needs of these kids? And now I practice in a youth detention facility and thinking about the trauma that these kids experience, about what they've been through, about trauma from a young age, various forms of trauma, just felt really compelled to think, how can we do a better job of taking care of them clinically, but not only clinically, but how can we think structurally, comprehensively about what needs to be done differently so that they can thrive, so that they don't come into contact with the juvenile justice system, and that if they do, the outcomes could be better. And I think that's why I'm excited for the Pathways to Resilience initiative, because it gives me an opportunity to think and engage others on how we could think comprehensively about strategies to address that.